I'm Dr. Bhide. I'm a consultant test tube baby specialist, and today I shall be giving some information about the types of test tube babies and the advanced technology which is made available in our test tube baby center, that is Bhide Hospital Test Tube Baby Center, which is located in Navi Peth in the heart of Pune. What is test tube babies? To understand what is test tube babies, we shall first know who need to undergo a test tube baby treatment. Patients who are suffering from infertility may be as a result of various reasons. Normally what happens is, if you see at the structure in the females, we have two ovaries on either sides. Adjoining that is the two fallopian tubes and the uterus, which is placed centrally, which is followed by the vagina. Now what normally happens is, from the second or the third day of the menstrual cycle, we see one egg which is getting ready in one of the ovaries, and it develops over a period of roughly 10 to 14 days. After it ruptures and comes and waits in the fallopian tube. Now at this time, if you have sexual intercourse, the sperms rise from the vagina to the fallopian tube, they mate with the egg and a baby is formed. Now this baby comes into the uterus and lodges itself within next 7 to 10 days, which is known as implantation. Now any deviation or anything that creates a problem in this natural reproductive function results in infertility. So whenever you're suffering from infertility, you need to see a consultant as to what is the exact problem because of which you are unable to conceive, so that once we find out what the problem is, we would be able to advise whether an artificial reproductive technology is required or what type of test tube babies would be ideal. There are several types of test tube babies, the commonest being IVF, but the latest technology which is available in the world is known as ICSI, that is intracytoplasmic sperm injection. In any kind of a test tube baby technology, the lady has to see the doctor from the second or the third day of her menstrual cycle, and she's supposed to take artificial injections to increase the number and the quality of her eggs in both the ovaries. Now once she attains a huge number of eggs in her ovaries, then within 10 to 12 days she is given general anesthesia, and a procedure which is known as ovum pickup is performed. In the ovum pickup procedure, these eggs are taken out through the vagina without any cut on the body, and the patient can be discharged the same day. Now in the test tube baby chamber, these eggs which are taken out of the body are mated artificially with the sperms with the help of the ICSI, which is a robotic micromanipulator machine. This baby which is formed is now incubated in an environment which is exactly similar to a human uterus for a period of 3 days, after which the division starts, and initially when we had only 2 cells are now grown to 8 to 10 cell stage, that is, a baby is formed on the 3rd day. Once this baby is formed, we again transfer these babies to another incubator for a period of 2 to 3 days, after which a blastocyst is formed. This is known as blastocyst culture. Now, this blastocyst culture is a breakthrough technology in the test tube baby sector, because of which the success rate has increased manifold, and even patients in their 40s are now able to conceive with the help of this blastocyst technology. Now, another technology which is rampantly used nowadays in our center, we use this technology as the primary modality of treatment for any test tube baby cycle, which is known as a frozen embryo transfer. What is done is, a baby is formed up to a blastocyst stage and it is frozen at minus 196 degrees by a technology which is known as vitrification, and these babies are stored in liquid nitrogen containers. After which the periods are resumed, and on natural menstrual cycle, a ready-made blastocyst baby is again got back to life. It is incubated at 37 degrees, which is a maternal body temperature, and this baby is transferred to the mother with the help of a procedure which is known as embryo transfer. So because of so many breakthrough technologies in the test tube baby sector, we are now able to give babies to even patients in their 40s depending on whether they have their own eggs or not. In case you have exhausted your eggs, or in case the sperms are absent in certain males which we see, a donor program, which is a legal way and a scientific way to get the assisted donor eggs or donor sperms, is available, because of which a baby can now be given even to couples in their 40 years.